2 minutes-ish. See how many we can get in here. We'll give it like 1 more minute and then we'll start some introductions. Okay, hi everyone. Welcome to the pre-med panel here. So in this session, we'll be hearing from admissions reps in a Q&A fashion. I'd like to start off by thanking everyone for coming, and I'm gonna let our panels introduce themselves. After I say your name, just please give a little background on yourself, such as where you went to undergrad and how you kind of ended up in this position you are today. So, Ellie, do you want to go first?
I had a feeling you'd call on me and I wanted somebody else to go first, but yes, I'll go first. So my name is Ellie Matthews. I am the admission recruiter at the Idaho College of Osteopathic Medicine, located in Meridian, Idaho. A background about me specifically, that's what you were asking, correct?
Just a little bit.
Okay, so my background is actually in communication and public relations. I went to Boise State University. A lot of people know that institution by the Smurf turf. That's what we're kind of known for. I got into my position because I was born and raised in Boise. I've stayed here my whole life. And when I heard a medical school was opening up, I checked into it and I have a connection here and they told me about the position and I applied and they liked me, hopefully, because I got the position. So I was the first recruiter and I'm the only recruiter because we opened our doors in 2018. And so it's been fun to kind of trailblaze a little bit in terms of recruitment. So that's just a little bit about me.
Trisha, do you want to go next?
Sure. Hi, everyone. My name is Trisha, and I am the coordinator for admissions here at OUWB School of Medicine in Michigan. A little bit about myself. So I actually went to undergrad in the Quad Cities. So I went to Augustana College in Rock Island, Illinois, and there I majored in business management and women's and gender studies. I actually moved into my recent role because of my interest in medicine. My spouse is a physician, and so I understand the whole journey from undergrad to medical school, residency, and now fellowship. So it's been a great ride. But I like to use that along with my experiences working as a hospital recruiter to help students in finding their path in medicine. So thanks for having me.
Brent, do you want to go next?
Sure, thank you. Hi, everyone. My name is Dr. Brent Owens. I am from the New York Institute of Technology College of Medicine. We have two campuses, one in Long Island, New York, and the campus that I'm from, which is in Jonesboro, Arkansas. A little bit specifically about me, Jonesboro is about an hour from Memphis, Tennessee, which is where I'm born and raised. I went to Rhodes College, which is small private in Memphis, and then I got my master's and doctorate from University of Memphis. I'm traditional higher education through and through. I've done everything from residence life to student life, just like Trisha has. My wife is a physician as well. She's an OBGYN, and we started dating probably about 6 months before she started applying to medical school. So I've also seen the whole gambit of things throughout the whole process. And so when she finished residency and we wanted to get closer to Memphis, Jonesboro was a good fit for us. And so I was, the only school that I knew at the time was Arkansas State University, which is where our campus is located. And I was very happy to find out that there was also a medical school that was just starting. And so I've been here for about going on 3 years now. I'm actually in a dual role right now. I was hired to be the associate director for pipeline programs, and I'm filling in an interim role for the associate director for admissions, and have been running this whole cycle. And it's been an eye-opening experience, but pipeline and admissions both kind of deal with getting people interested in going to medical school. So it's been a good fit, and I've been happy to be here.
Thanks. Anton, do you want to go next?
Sure. Afternoon, everybody. My name is Anton Johnson. I am the recruitment lead for the MD program at the Medical College of Wisconsin. Went to Wisconsin for undergrad and legal studies background until I discovered that I had absolutely no interest in practicing law whatsoever. It was after I got the degree that I figured that out. So, there was that fun time after undergrad where you bump your head a little bit. And as I like to say, I slipped and fell into higher education, but I worked for a couple of different schools, including some of those online schools with the really cool commercials that we all make fun of. And it just kind of kept going. And some years later in higher ed, find herself on the medical school side of things, which is a totally different ballpark, but it's very rewarding. Med students are amazing people, and the applicants are too.
Thank you. Ryan, do you want to go?
Yeah, thanks for having me. My name's Ryan Wessel. I'm the director of admissions here in Omaha, Nebraska for Creighton University Med School. We also have a 4-year campus that's opened up this year in Phoenix, Arizona. So kind of oversee both campuses there too. My path, did my undergraduate degree at a fellow Big 12 institution at Kansas State. So I've been in Ames a handful of times for some sporting events and for some fun things up there. Did my master's degree at Northern Arizona University. Been in higher ed for quite a while. Worked at 5 different institutions, a couple different med schools. Been in this role for about 4.5 years. So really enjoy it. Thanks for having me.
Sarah, do you want to introduce yourself?
Yeah, I'm Sarah Roser Jones. I'm the Associate Director of Admissions at the University of Chicago Pritzker School of Medicine. We're a tiny medical school on the south side of Chicago, and I'd love to tell you more about it a little later on today.
Thank you guys. We're all very excited to hear from you. To start us off, I have a couple general questions for the panel that was sent in ahead of time. And if any students have a question, they can put it in the Q&A feature down here, and I'll try to watch that to answer any of those questions. So to begin, what are the top 5 best qualities or experiences to have on an application?
I mean, I guess I can jump in real quick. So specifically talking about OUWB, but I'm pretty sure that this relates to all medical schools. Top experiences that we're really looking for is community service. So we really like to see community service, and it can be, so students usually ask, like, what's the kind of service that you're really looking for? It could be anything. It's really with medical community. We love to see local community service to really see what your dedication is to your community, your altruism. And so that's something that we're really looking for in regards to your application. In addition to that, medically related experiences, and really what the purpose of those medically related experiences is to see that you have kind of researched medicine, so that you understand the field that you're entering into, and that you have an idea that this is the field I want to go into, that this is where my passion might lie or my interest might lie. You might not know exactly what your specialty is. There's absolutely no reason for you to even know that at this exact moment. But at least this is what I can expect in the healthcare field, and this is maybe the field that I want to make my impact in. So I would say that those are just at least the 2 major things that we're looking at.
I actually wanted to, so a lot of, what Trisha just said, definitely, and also too on your written materials, that side. Something to bear in mind as an applicant to medical school, every chance you get to write something is a chance to be reflective and make an argument for yourself every time. So you want to give a good account of your motivation, flesh that out, talk about why you got to this point, and that understanding of why you want to go into medicine. Specifically, why do you want to be an MD? There's so many different things you can do in healthcare, so many different things in medicine. I find some applicants take like a broad approach, want to help people. And it's like, you can help people as a PA, as a medical assistant, as an RN. Why MD? That comes with its own unique challenges and responsibilities. So know why specifically you want that. Be able to speak to it.
I want to follow up with that, kind of going on Anton's point. Medical school, when it comes to applying for an MD school and a DO school, they're two separate applications. And so understanding that you can't just copy and paste from one or the other, because we do read those personal statements, we do read those experiences. And so if you decide to choose the MD route or decide to choose the DO route, make sure that you're applying what you're saying to that route. Because if we read something and say, oh, they're talking about how they want to be an MD. Well, we're an osteopathic school, so we train DOs. And so make sure that you're proofreading, doing grammar, and showing that passion you have to become a physician, just like Anton was saying, and also Trisha as well. And passion comes with being able to eloquently say what you want, what you're learning from your experiences and your achievements and your publications. But I'm sure somebody else can kind of touch on that as well. I don't want to take too much time for what I'm saying. So I just wanted to follow up on that.
Yeah, I agree with what everybody says. I would start with the AAMC's core competencies. There's 15 different core competencies out there that kind of lay out what everybody's been talking about here. So that's a good place to start. Everybody's going to focus. Every school is going to look at those in some way. Some going to focus more on certain areas within those, but everybody's looking at those core competencies at some level. So just starting there and kind of looking at that. And the second thing I just kind of add is, it's your story, your path. That's what we want to hear about. We don't want to hear about this path that's online that you think we want to hear. We don't want to hear those things you all think we want to hear, kind of thing. It's your story, your path. That's what's going to get you into med school and get you through this application process.
Yeah, kind of going off that question, with the COVID-19 pandemic, to be taken into consideration when reviewing future applicant based off like limiting hands-on experiences and like that shadowing and like that type of stuff. How do you guys feel about that?
It's been difficult. I think we all understand that we've had to make some adjustments in what we would normally see. And as I continue to talk to students that are in the current cycle and people think about applying for the future cycle, I just want to let people know, we understand it's a different ballgame, and we're not going to hold things against you if you weren't able to do 600 hours of in-person shadowing that you maybe had planned. Like, those things are nice to have. It definitely kind of elaborates on a lot of things that everyone talks about. It does give you a foundation for why you maybe want to do this and why physician instead of being a PA or other things like that. That all goes into those experiences that you can bring to the table. That being said, we're in the middle of a pandemic, and we understand that we got to play with the cards that we're dealt. We've made some adjustments on what we've doing on our end, what we're expecting from you all as far as, I know my school, we're taking the January MCAT when we don't normally take the January MCAT, because in the beginning, things just got shifted so much. And so we didn't want to penalize people. We're going to try and take into account as much flexibility as we can to ensure that we're still getting good quality applicants, but not going to penalize anyone for not being able to develop the COVID antibodies and be able to break all the rules and just be able to rotate and do whatever they want when no one else can.
To feed off of that, I don't want to take too much time, but to feed off of that, what are you doing right now? Because in-person shadowing has been canceled. It's like a two-way street, just as Brent was saying. If you had all your shadowing canceled, are you just going to sit there and not do anything? Or are you going to try and get virtual shadowing? Are you going to try and open up a conversation with a physician to get the resources that you do need? And so you still have to do work, even though it's hard, but we want to see that you do put that effort forward, and you are trying to accomplish what you are trying to do creatively, at least, because COVID-19 is a pain in the tush, but what are you doing to overcome your challenges? Really quickly on that, there are also COVID-19 essays, I think on both applications, that you can talk about what you've faced and the challenges that you have faced. So look into that as well.
I'll
I'm
say
just
something
gonna-
else too. I'm sorry, Trish, you can go ahead.
No, go ahead. I was just going to say that the name of the game, at least this cycle and the next few cycles, it's not just this one. It's going to be the next couple of cycles are effective. It's be creative. That's the name of the game at this point.
It's pretty much what I was going to say. You'd be amazed at how many of your experiences are how you speak to them. You know, so many people are like, yeah, I have shadowing, but it's just virtual. It's still a worthwhile experience. Why are you talking about it like that? You know, what did you get out of it? Tell us. Want to know.
And it's more shadowing than I've done. So it is a great experience. So please take advantage of all of those things because it's going to help. And as we've all said, like adaptability is the name of the game right now.
Also, utilize us as resources. We are representatives of the institution and we're not scary to talk to. And we can kind of help you in ways that you might not know the answer to, like, oh, do you even accept virtual shadowing? Yes, we do. And most of the schools do. And so if you're confused or you don't really know where to start, just call us and we can kind of give you a little bit of direction.
Yeah, don't go to Student Doctor Network and Reddit for your advice first. Representative of the schools that you're applying to are probably the best place to go first. Not to say that people on there aren't being altruistic or looking to help you, but the school is the best source of information.
So what would you guys say like a good number of clinical hours to have for your application?
I know that this is probably not what you want to hear, but it's quality over quantity. I can't give you a number. If you have thousands of hours, but you can't speak to them in a meaningful way, and when I ask you about them, your face goes blank. I would rather have someone who had 20 hours, but can tell me a really compelling story that they had or time interaction that they had with the patient. So it's really about quality over quantity. And I'd love to hear, I need you to have enough hours that you can, again, speak to your motivation for medicine. Why do you want to be an MD? Tell me about the things that you've seen.
Yeah, reflection, pros and cons, know what you're getting into. I mean, you got to have enough to know that, but that's what we're all looking for.
How important is GPA compared to experiences or positions in an application?
I mean, everything goes together. It's all puzzled together. It's all we're taking into account everything there. You know, we need to know that you can take courses, you can manage your load in medical school, you can pass board exams, stuff like that. So, you know, I think everybody's looking for trends in GPA too. Everybody, you know, you can have a rough course, you can have a rough semester, maybe even a rough year. Sometimes when you have too much of a rough year, you got to go and take a master's program or something like that, or post-bac to show you can still handle the load. But it's all about trends. It's all piece of the puzzle type thing. I can tell you the lowest we took straight out of undergrad, it's about a 3.25, 3.3, somewhere within that range every year, obviously all the way up to a 4.0 there. But it's really, you know, it's about trends in your education and it's about, you know, stuff like that.
So there's no piece of the application that dictates its success. Like there's not just one thing. I mean, MCW, we don't have GPA or MCAT cutoffs anyway. But you know, I've seen things all across the board. I've seen, you know, 4.0 GPA doesn't mean you're shoo-in. I've seen a 527 MCAT not get an interview. You know, there's things all over the board. So it's not just focusing on one thing. Like schools are really looking at the totality of your application. So many, you know, moving parts.
I think a lot of schools are moving towards, or at least embracing, I feel like everyone who's spoken here today, you know, that holistic review process is really the name of the game. You know, we understand that you're just not these numbers on a page. And yes, like just because you got a 100 percentile on the MCAT doesn't mean that you're going to be the best medical student. And if you did a 4.0 through everything, that doesn't mean anything all in the grand scheme of things if you're not supporting yourself in other areas. And so that holistic view of who you are is what we want to see in the application. And yes, we need to know that you can handle the rigors of medical school, but trends are a huge part of that. If you struggle at the beginning and you're coming out strong at the end, that's great, and if you're doing things to support you outside of just your scores, that's what we really want to see, so we can get a grasp of who that whole picture of who you are is.
What are some things that your school does to promote and support underrepresented students at your institution?
I'll go first because, as we all know, Idaho isn't the most diverse state. We're pretty low there. And so as an institution, that's pretty new because, like I said, when I introduced myself, ICOM opened its doors in 2018. And so we don't have a huge diverse class, and we're very open about that. And so we actually met this year, and we have a diversity and inclusion task force on how we can implement more diversity, more equality, and more inclusion, or DEIs. You'll hear that in the future. DEIs is like a very common name to call it now. How we can implement that in every facet of our institution, whether it's employing people, recruitment, admissions, curriculum, whatever it may be. And so there's a lot that a lot of institutions are doing. This is my point. And so if you want to know specifics, I would reach out. But at least for us, we are recruiting a lot more in other areas. We're trying to promote underrepresented in medicine. And so that means even women, that means different cultures, et cetera. And so you'll see a lot more support and attraction for these underrepresented in medicine. And so sometimes when you not want to know the focus, you should just reach out and call us, and then we'll tell you what we're doing in trying to support and attract underrepresented in medicine.
If I were going to say anything, I think at this point, each institution can always do better. So we're all working to do better. We're all trying to do better. Does that mean that every institution is going to have such a diverse population? No, statistically, we see that that hasn't been the case for decades. And so it's at this point with, the call to action from students and the call to action from administration. So for example, OUWB's dean, we have again, a DEIC council that we just started. We're also a school that's only been around for 10 years at this point, but our institution, Oakland University, we've started a program and we're putting in money. Our president just gave $300,000 of our own money to hire faculty of representation, so faculty of color, and our students are getting involved in making decisions here. So it's not every school is going to be doing something differently, which is what Ellie was talking about, but every school can do better. So when you're asking questions of the school, what kind of feeling are you getting from them? Are they going to be supportive of you? Are they going to be, do they have some of those systems in place? Are they working on it? Are they open to hearing feedback as well? So I think that all plays into how you feel on the campus. And I don't know if that's how everybody else feels, but I feel like that's what we're trying to do at our institution.
Definitely. Listening to the students is such a big aspect of that too. Listening to our underrepresented students with everything that went on this past summer. Our students, we had a number of different conversations because we have chapters of, like the Latino Medical Student Association, the Student National Medical Association, all these diversity related groups. We're having these conversations. We started a chapter of White Coats for Black Lives at MCW this past summer because, of what was going on. This is something that was important to our students. Also for us, we have a lot of pipeline programs, both national and kind of trying to affect like the immediate area, like the inner city of Milwaukee too, where we have people coming from all over the place doing research, talking about medical school. I work with those programs a lot, talking to people about their application, gauging, raising that interest in medicine, because it's not like there's no interest in medicine in minority communities. That's not true. It's just once we get to that MD, DO level and beyond, that's where it tapers off some. So raising that awareness, is a focus of a lot of programs that we have. But the work is being done, but this is something like the reflection of that will take a long time. So this is something that you have to continue to watch. But like Trisha was saying, everybody, we have a long way to go. But I don't think there's any institution that the work's not being done.
Yeah, I would agree. I don't think anyone's like singing from the mountaintops. We're doing the best job ever, And so I think it's important that I think a lot of schools are reacting to what happened this summer, and I think that is great. I think my school, as we've already mentioned, Ellie mentioned DEI. We've got a couple different DEIs. I've been on the DEI for our broader school for our undergrad and our master's programs and the doctoral program, but we also have a DEI that our students started with their own initiative this summer. And so they've got a direct ear to our Dean of Students that I've actually been asked to be a liaison between the students DEI at the medical school to the larger DEI that involves all the president of the college is on that as well. So, I think it's important that the movement continues and students' voices are heard. And I think that's what everyone's kind of here saying. As schools try to become more receptive to what's going on, every school is trying to move in the correct direction, and that student voice is a big part of that. And so making sure that the school that you're going to is providing those opportunities or at least willing to listen, I think is a huge part of what's going on. Every school is going to have to do things their own way to get to the finish line that will always continue to move as we continue to try and do better and better. But knowing that a school is attempting to try and listen to their students and develop new things that will impact things all across the board, I think is the name of the game.
I want to just follow up really fast because it kind of popped in my head as Anton, Brent, and Trisha were talking. A lot of times when you are trying to figure out what school you want to go to, whether it is just a graduate school or especially medical school, since that's what we're talking about, you have to find the fit that you want. So you have to find a school that fits with you and where you will feel successful. And this is actually a very big component of that. And so like Trisha was saying, I just want to reiterate that you have to kind of find the school where you feel like you will be supported. And maybe that is DEIs, or maybe that is the geography or just the culture, but this is a very big topic of conversation when it comes to finding that school that fits with you. And I just wanted to throw that out there and just kind of wrap it together.
Yeah, thank you. One of the students put in the chat, if you had to choose one or two top qualities in an applicant, what would they be?
I'm not going to give you one part of the application. There's no one thing that's going to dictate whether your application succeeds or fails. But as far as your attitude, your I think the motivation is the core of everything. Understanding who you are, understanding your motivation for medicine, being able to speak to it, being rooted in that. You need to be able, this is hard. This is an investment. It takes like 1.5 years to apply to medical school. Medical school takes years. Residency takes years. This is going to be the better part of the next 10 years of your life almost, or maybe even more. So where is that coming from? Why are you doing this? That's probably the biggest thing I think, that'll affect you personally.
I would say this is a great question, and I think every school can answer it differently. But I know at my school, when I'm reviewing files, and I've been reviewing 100 files a week, I'm looking for authentic people, right? I can really tell when I'm reviewing files, and I think I can tell when I'm reviewing files. Someone is telling me what they think I want to hear versus what they just need to tell me their story, especially in their personal statement. Like it is. I read a lot of them now, and it's pretty clear to me early on if this person is not being authentic with me. And so that will go a long way with me in our school. We're a small institution. We only have about 115 seats in our Arkansas campus. The New York campus is a little bit larger with around 300. But our culture is very family friendly, and it is very much everyone knows everyone else. And so we're really looking to get a sense of who you are in that application. And, yes, I want you to brag on yourself. I want you to tell me the great things that you've done, but I don't want you to copy it from Student Doctor Network, and I don't want you to copy it from Reddit. And again, all those things that they think we want to hear it doesn't really come up very well when I've also been reading 30 other applications that same day that have the exact same structure and layout. And it's like, come on, guys, I just want to get to know who you are as a person. And if you can do that, that's going to go a long way with me in our school.
Like to add, I cannot give you a piece of the application, as Anton noted, but one of the things that I know that we look for and gets commented quite a lot in applications is passion. What is this person's passion? What is the patient population that they absolutely have to serve? What is the research question that they have to ask? What is the policy issue that they must address? If we can tell your passion, and usually that innervates many different experiences in many different parts of your application, that's something that all of our students have.
Yeah, thank you. I know a lot of students are curious about like gap years and if they're good or bad. So one of the questions that came up was, is time since graduation a major factor in admissions and acceptance? And are gap years disadvantageous, and to what extent?
Gap years are completely fine, completely good. You know, I'd say you're, as long as you're trying to improve yourself as a person, as an applicant, you can take gap years all you want, kind of thing. You know, there's a, for us, at least in our committee, there is a sense, you know, once you're out of school for 4 or 5 years kind of thing, you probably need to take a class or two before getting back into it. But taking a couple gap years, 2-3 years, doing whatever it is you want to do, whether it's working in medicine, it can be completely outside of medicine, that's fine. Gap year is completely fine. Just trying to hopefully improve yourself as a person, as an applicant along the way.
At this point, I think the word reflection can become cliche. It's not really about what, you know, how many gap years you took, but what did you do in those gap years? So it's not one specific thing. And I think that's what students want to hear. They want you to guide them to tell you, what do I have to do to get into medical school? And it's not about that. It's, if you are taking a gap year, what are your reasons for the gap year and what are you going to do in that time? What is something productive? You can't go surfing in Fiji and say that it was a global experience. You know, you are taking either, even if you're taking time to study for the MCAT, what did you do in addition to that? You know, maybe you were doing some additional medical exposure. Maybe you were trying to find something else that you're interested in. And, you know, and it's, and then in the end, it's the reflection. So I think ever since the first question, that's been the answer here, is how are you talking about that experience? And in essence, you're really just telling us your story. So it's okay if you took that time off, but, you know, what did you supplement that time with?
It's not just an automatic, you know, you took too much time. Like, this isn't like a time limit thing that we're talking about. You know, first years range from 19, 20 years old up to, I've seen a 50-year-old M1. You know, there's people, you know, everyone's not a 22-year-old fresh out of undergrad, their M1 year. People take time, people do different things. Again, Trisha hit the nail on the head. Are you doing something edifying to your application? You know, that's kind of helping you, you know, advance and learn more. That's going to help your application and you as a medical student. How are you using the time?
Yeah, another topic that came up in a lot of the questions was like the interview process. So a lot of them were curious about, should you ask questions during the interview? And if you are, like, what questions should you be asking who's interviewing you?
I'm going to jump in. I interview about 700 candidates every year. And yes, I want you to ask me questions. I get very annoyed when you're thinking about spending the next 4 years of your life at a place and you don't have a single question for me about it, about the neighborhood, about Chicago, about what I like about my students. Yes, you should have a question. Now they should be well-researched questions. If Google can answer this for me on the first hit, that's not probably the question I want you to ask me. But I do encourage you to ask questions and be highly engaged in your interview. For us, and I can't speak to all medical schools, but for us, our interview situations are very conversational. It's a back and forth. And so it helps a lot more. And so it's a better interview for both people if you're excited, you have questions and you're excited to learn things and you're excited to talk about the things that you have done in preparation for the interview.
Ellie, we're gonna go. I was just gonna say, one thing to remember with interviews too, if a school invites you to interview, they consider you admissible. They like you. Otherwise you wouldn't be there. I know you're going to be nervous on your interview day, but like, you know, like we have open file interviews and people who come away from our interviews are always like really amazed at how conversational, like, and kind of how normal the interview conversation is. Like, because I think people So many applicants expect to come in on interview day and we're going to pull up the file and be like, you got a B- in OCHEM in 2016, explain yourself. Like, we're not going to do that. If you're there, we like you. So it's just something to bear in mind. At that point, we just want to get to know you. So you should be asking questions. You're also interviewing us. Interview is not a one-way exchange of information. If you're doing that, you did it wrong.
Yeah, and we invited you for you, not this rigid version of yourself, not this like completely polished. Yeah, you want to be polished, that sort of thing, but you don't want to. You want to be you. I mean, that's who we want to know. Those are the people that excel in interviews.
And when you think about it, interviews are only 30 minutes, potentially a little bit more. And so why wouldn't you really have questions? It's this very small interview and a lot of it is focused on you. So like Anton said, you are interviewing us as well. We want to see if you're a good fit, but you want to see if we're a good fit. So there's a lot of questions you can ask, and there's a lot of things that you can try and find out, and you only have 30 minutes. So it makes sense that you'd have questions,
Yeah, someone put in the chat, when asking questions at interviews, should it be more open-ended or more of like yes or no questions?
It's a conversation. I think everyone's going to say we want it to be open-ended and a two-way street. It needs to be a fit for you. It needs to be the right fit for us. A yes or no answer is not necessarily going to be the best way to do that. So I would definitely plan on having a conversation. That's what an interview should be. And no, yes or no's are fine, but if you can do more open-ended and have a conversation, that's going to make a better impact.
If you have the opportunity to do a mock interview, I would take advantage of it if you are nervous about it, because those can really help. Since having pre-done questions is perfect. I mean, that's great, but sometimes when you are in a conversation, it'll bring up more questions, and being able to work on those interview skills and those conversation skills can really benefit you. So if you have the opportunity, definitely take it, because that can aid in your stress of, should I have yes or no questions? Should it be conversational, etc.?
Going back to gap years, someone put in the chat, are there any like recommended research work or educational experiences that would stand out from others?
I think that's a good question that I think can be answered a couple different ways. I think from my background in my school, I think it's a combination of do something that you want to do that's going to make you happy and make you, if you're getting ready to get into medical school, it's not going to be the most exciting time that you're going to have all the time in the world to do. So do something you enjoy, but also look at what your school values. Like research is super, super important for a lot of schools. It's not the highest thing for our school. And so a lot of people, they ask us that question, like, I have to do so many publications. And I mean, we definitely look at that. It is not a make or break. We're definitely going to accept a ton of people who've never done research before in our school. So I would say, again, that kind of goes into the fit kind of category of look and see what schools that you're looking at really value and what's super, super important for them. If you really want to be the most beneficial with your time, specifically only trying to improve your way into medical school, then, definitely a master's program or a post-bac or something to make you a little bit stronger is not going to be a bad idea. But again, also, I don't want everyone here to feel like you have to do something. A gap year can be a time that you can reflect and enjoy your time and, find those community. I think one of the first thing we talked about was community service. That's a great time to incorporate some of those things when you're taking that time off in between your gap year. So there's a lot of different ways that your gap year can be very productive and still very enjoyable. And so I would really encourage people to lean on that and find something that makes sense, that accomplishes both. If you are not someone who wants to be behind a microscope 40 hours a week for a year, don't do that. But if that's something you enjoy, then absolutely go for it.
I would second that, but also I would suggest that students, whatever school you're interested in, to see if they have any like webinar events or, admissions events that they're talking about, what they're looking for in an application specifically. If that's something you're interested in, for example, our school, I have a monthly webinar and we talk about that and I answer those questions frequently and often. What are you looking for? Well, every school is different, right? Every school's mission is different. And so depending on what you're interested in and what you want to do in your gap year, and if you want to see if this is something that's going to resonate with the institution, contact them, go to an admissions event, go, research some of that, and then that'll give you a good idea, and you can have those conversations. Don't be afraid to have those conversations with the medical school. It's not going to affect your application, right? I don't remember who called me and asked me, is this event going to be the best thing I can do for my application to get me into the medical school? And then you apply. And then if you come to me during interview day and you say, yeah, you gave me this great advice, I'm not going to remember the advice I gave you specifically for you. It's about what is there for the medical school.
And as you know, this is proof we're not intimidating. All of us are very welcoming. All of us have been very, very kind. And that's so similar to all of our other colleagues in the realm of admissions and helping prospective students and applicants. And so, yes, I second, third, fourth, fifth, what Trisha said. Call us, ask us for help, because there is not a stupid question. I've heard that so many times through my elementary, high school, and collegiate career. There's no question that's a stupid question. I mean, somebody can ask me the same question over and over and over again, and I will answer it, and I will happily answer it over and over and over again, because that's what we're here for. We're here for you, to help you along this journey and to help prepare you for a potential career in medicine.
We had a few questions about various scholarship opportunities. One of them was specifically about first generation students. So if you guys want to talk about some of the scholarship opportunities your institution has.
I could start here. So we have plenty of scholarship opportunities, M1 through M4 years. First generation is actually part of our definition of diversity. Each school gets to define their definition of diversity and what that means for them. So that first gen actually plays a part in our role of diversity at Creighton. So there's some extra things there, but there's merit-based, there's a bunch of other kind of scholarships that go out. There's donor scholarships that go out to, and donors, they can make the scholarship be for whoever they want it to be for. We have, no kidding, have one for a female that's over 6 feet tall from a rural area. So it's just, there's some weird ones out there that donors will put in there. But there's a lot of different ways to finance your education in this realm of things. The health profession scholars, the military scholarships are a good route if you're really worried about taking on debt, sort of thing. Always recommend some of those. They're usually 1-for-1. I think Navy's 1-for-2. But every year you commit for medical school that they pay for is a year you have to do first service there, and they're not throwing you in the front line by any means. They're protecting that asset kind of thing. You're an asset to them. So they pay your tuition, they pay you a monthly stipend. It's a good route to look into there too if you're really worried about that. But you can always pay off loans when you get out of school too. There's any amount of loans. There's forgiveness plans for physicians. And after 20 years of making minimum payments, your loans are forgiven there. Within that, there's a lot of stipulations, goes a lot more in depth than that. But basically, you pay for 20 years, and if you haven't paid off all your income there, whatever's left over counts as income on your taxes for that year, kind of thing. But then all your loans are forgiven. So there's a lot of ways to do that. It's a big, large number. I get that. There's a lot of scariness that goes into taking on that amount of debt sometimes, but there's ways to do this. There's people to help you work through this as well. We have financial aid counselors that are just dedicated to the med students only. So there's ways to finance this.
I think something to speak to on the financial side too. I mean, as far as like the types of scholarships, I could pretty much echo what Ryan said, except for the one specifically for tall people from rural areas. We don't have that. I haven't heard of that one. But as far as, the general need-based, different diversity related things, you'll find that it's the same across the board at many institutions. But from the financial counseling side, so you can't work in medical school. Like you can't do it. So a lot of people are living off their loans, and doing different things. And there's extensive counseling. This is kind of a crash course. Like, we're going to tell you have this much. This is what you're going to get. This is how you need to manage this. A lot of people don't know this. A credit check is part of the application process in a lot of places. I know we run. So, you know, we're going to like, there's extensive financial coaching, you know, that goes into this, because this is, you know, I won't sugarcoat it. Financially, this is going to be a difficult period. It will, but, you know, we will give you, you know, you'll have what you need. We'll talk you through it, but it's not going to be easy.
I'm sorry, I'm talking a lot on this, but so when you interview places, if you go out, that sort of thing, you can always ask students to, hey, what's kind of your budget a month? What do you spend on rent? What do you spend on, like, cost of living at places varies so much. So that's the kind of stuff you can't take away from a website. So you have that conversation with the student. They won't think it's weird. And just kind of have that, you know, what's your monthly kind of budget to spend on other things? It's always a good thing to do.
Yeah, those are good points. Just to wrap it up a little bit, do you guys want to give really quick advice for your college age self?
It's going to be okay. And if you are really trying, if you know that medicine is what you want to do, I think this has already been said, so I'm just going to reemphasize that we try to do this with our students. It's really important you find the place that's the right fit for you, because that's what we're looking. We're trying to find people that are the right fit for us. And it's also important that you as an applicant find the right school for you. Sometimes that might be the only place that accepted you, and that's going to be the right fit. But if you have options, it's going to be okay. You need to make a decision that's going to benefit you in the long term. And I think the best way you can do that is making sure that you're finding the right place that's the right fit for you, regardless of what the prestige or anything else included with that. If you go there and you feel like it's the right place for you to go, that's what you need to do.
If I were going to add anything to my college age self, or to any college age student that's applying to medical school, don't let imposter syndrome get to you. That's a huge issue. And even when you get into medical school, sometimes you're going to have this moment where you feel like you don't belong here, but you do. You belong here, and you're going to be able to make it, and you can do this. It's going to be hard, but you can do it. And it goes two ways. Even if you don't get into, so medical school is tough to get into. And if you don't get into it the first time, and this is really still your passion, don't give up. You'll be, do it again, work on your application, reach out to admissions, or, to the medical school, or your pre-health advisor at your alma mater, and talk to them and see what else you can do to improve, and, try again, especially if this is something that's really important to you.
I think also understanding that medical school is a big part of the life that you might be living in your future, but it's not your whole life. Okay, really quick, I was watching Grey's Anatomy last night, and I think it's Dr. Yang. I don't really know too much of the names, but she's asking Meredith's mother if she can do both, have a life and be a heart surgeon. And I was sitting there and I was like, of course you can have a life, because it's a big part of your life. But remember, it's not your whole life. You still have other things that you enjoy. And maybe that's being part of a fly fishing club. And you can do both, and understanding that that balance needs to be there. And so really figuring that out as well, it might help you in your future.
It's a marathon, not a sprint. You know, don't be hard on yourself. Don't be hard on yourself imposing timelines. You know, sometimes it is okay to wait if you're trying to get certain experiences, or you'd be stronger in the future. Starting to practice medicine at the age of 31 or 32, opposed to 30 or 29, won't be the worst thing that's ever happened to you. I promise. And something from students that I've talked to that I always want to impart to people: before you even get into medical school, you're still in the application process, or even the beginning of your M1 year, is not the time to be worried about and freaking out about STEP. Some people are wound up about that from the jump, even before they get into school. Like, don't be. You'll have support for that. So don't be worried about that in orientation week.
Yeah, I'd echo, don't get caught up in this path that's drawn out online. You see these pretty graphs, and it's like, oh, year one, I got to do XYZ. Year two, I got to do this. Year three, I'm doing this. And if I haven't done that, I haven't done that year two, why am I, don't get caught up in that. It's your path, your journey to medicine. Everybody's is unique, and don't get too caught up in some of that stuff. Yeah, they're good guidelines. They're good, things to keep you motivated and say, okay, these are what schools are looking for. But you don't have to be that copy and paste applicant kind of thing. Be you.
Well, thank you all so much for coming, especially to our panelists. We really appreciate you guys taking your time out of your day, especially your Saturday, to be here with us. So students, if you want to go back to the website, I think we have one more opportunity to talk with other schools. Other than that, thank you guys so much.
Thanks for having us. Good luck, everybody.
Thank you. Good luck.
Much
Thanks,
appreciated.
good luck.